Hello, this is Catherine Calarco, and you're listening to Humanity Evolve. I am joined today by the amazing Irma. She is going to be talking to us about digital transformation, AI in healthcare, and how the importance of storytelling enables leaders to help create that positive impact for patients, stakeholders, hospitals, doctors, nurses, and the entire system. Irma is a Boston-based B2B social media strategist. She's a marketing consultant and storytelling coach. She is across the intersection of health, technology, and patient experience. And I love that because it's very important to keep the human in the center within what we're doing with the future of AI in healthcare. So she's named as one of the top 30 women in tech and widely recognized as one of the top influencers across healthcare. Irma, it's wonderful to have you join me today. I know we had a great conversation a few years ago about digital transformation. I love the opportunity to continue that discussion to talk about the advances in AI in healthcare. Please welcome Irma on board, everybody. And Irma, please introduce yourself a little bit more and then we can start the conversation.
Absolutely. Thank you so much, Catherine. I am delighted to be here with you, and I'm delighted to be talking about this very important topic of AI in healthcare. And so thank you for the great introduction. A little bit more about myself. Yes, I am a marketing strategist and storytelling coach, but my background is actually in engineering. I have two advanced engineering and engineering management degrees, and I have spent 20 years in product development, technology management, most recently, 5-year tenure at Google. But what makes my background is maybe somewhat unique is that I've also been a patient advocate for 30 plus years. So my passion and interest in healthcare is deeply, deeply rooted in a lot of personal stories, myself as a patient, some close family members, as well as helping many others navigate the healthcare system. I've developed a passion for storytelling through my work with TEDx Boston. I founded the event 12 plus years ago, and just got more and more convinced that the storytelling is one of probably very important ways how we can get our ideas across and how we can get buy-in and kind of build the communities that we need to get great things implemented and done for the patients, for the providers in healthcare and beyond.
Yeah, that I really feel that's very important. We're still, even though we have all this advanced technology, we are still humans, right? We still are learned through storytelling. Our brains still are most positive when we're in groups together and connected together. And I think the power of storytelling is pervasive through that and is so important, and today we're talking about, how storytelling drives the use of AI and also the role of leaders in incorporating it, the challenges and opportunities, and the power of storytelling. So I'm just going to start with our first question, which is, where do you see some of the major opportunities in healthcare and AI, and where is it working, or how is it being currently used?
Absolutely. I should start by saying that it might seem like artificial intelligence or AI has burst onto the scene only in recent months with the, let's say, release of ChatGPT in November last year, and how everybody's talking about it, and how it's been really an unprecedented number of people that have been trying this technology for themselves. But AI has been rapidly growing over the last decade or more with applications in various industries, and it has been increasingly gaining traction in healthcare in recent years. For example, at HIMSS, a major global industry conference that took place last month in Chicago, where I was, and so for myself, generative AI and its role in healthcare took center stage. Companies such as Microsoft, Google, and Amazon are partnering with healthcare organizations to implement health solutions using generative AI. But personally, I see AI being a major catalyst for kind of general digital transformation in healthcare, with several areas in particular presenting major opportunities for artificial intelligence. So let's talk about one to start: medical imaging and analysis. So AI systems being used to analyze medical images like X-rays, CT scans, and MRIs, which helps identify and diagnose diseases. So specifically for diagnostics, we know that AI-powered diagnostic imaging tools can improve accuracy and speed of diagnosis for a variety of conditions. One being cancer, for example. By analyzing mammograms, CT scans, and MRIs, AI can do even a better job sometimes than radiologists in pinpointing some very early signs of disease. Now, in terms of drug discovery and clinical trials, AI is being used to help identify new drugs and speed up the process of clinical trials, which are so important for development of new treatments. AI can also help, in addition to developing new treatments, it can improve the effectiveness of existing treatments. So finding new approaches, new applications for treatments that already exist. So AI-powered algorithms can be used to personalize cancer treatments depending on specific patients' genetic makeup and some of the other kind of specifics to their disease. Now, something that people might be more familiar with is the use of AI in virtual health assistants. So if you had any kind of interaction with a chatbot when it came to healthcare, or sometimes even on a portal communicating through your doctor, doctors are now on the back end might have some assist from AI in terms of responding to queries from patients. Another thing where patients themselves might have come across AI without even realizing that that technology is being used is in remote patient monitoring. So there's some devices that are AI powered that are used to monitor kind of patients remotely, and that could help reduce hospitalizations. It could help maintain closer loop with the physician for chronic condition management and so on. Now, in terms of kind of wider use, predictive analytics, this is where AI can be very, very helpful, predicting disease outbreaks and analyzing kind of health data on a population scale to identify patterns and trends. Another area where people might have come across already, robot-assisted surgery. So they might not realize that AI algorithm and AI-powered robots could be behind the scenes, getting that surgery to be less invasive and more precise. And then one topic that is being discussed more recently is AI's use in healthcare administration, and that is to kind of lower the burden of paperwork and administrative tasks and remove that burden from physicians and nurses and medical assistants to the tools powered by AI. So we can talk about all of these in more detail, but I just wanted to give you kind of an overview of where I see kind of major areas for AI in health.
Yeah, the idea that algorithms and machine learning has been incorporated into healthcare, from everything from drug discovery to patient follow-up, is important to recognize, right? That we've actually have experience using this, and also there's new opportunities because of the advances that you're seeing to actually leverage it further to achieve greater health outcomes, more accurate and precise diagnosis. And even take, I mean, what I'm seeing is, let's take the burden off of physicians and nurses. I mean, we just don't have enough time, and we don't, in many of the rural areas, we don't have enough healthcare workers to actually serve that community. And how can these tools help people and help the people within the hospital system to care for the community they serve? And I think that's one of the great opportunities we have to manifest. Now, it's easy to talk about the miracle of, the promises of, and everything's gonna, we can really change so much. And I mean, there's just the other day, there was, I think 10 new plugins and apps for healthcare, to help maximize everything from aggregating complex research to, like you said earlier, enabling chatbots. But what's the reality? Where is it stuck? Where you talked about things that are working. Maybe you can give an example of maybe where things are stuck.
Sure, and I want to acknowledge first that yes, there is indeed an explosion. I think explosion is the right word to use here in terms of all the AI, AI itself, the algorithms, the machine learning, the generative AI, but also various tools on top of it. So you mentioned APIs and plugins, etc. So as far as adoption of this, so we'll have to see. There may be some future use where these could be incorporated into actual physician workflow, but I don't see any of this happening right now in the real world. This is more for people to experiment and try. And I think we need the explosion of interest and excitement because everybody's trying to kind of get on the AI bandwagon, but we have to, especially in healthcare, we're dealing with people's lives.
Yeah.
We need to have a careful approach and we need to sort out what is hype and what is true. As far as what's happening in reality, back to using AI for cancer diagnosis. So there was a recent study published in the International Journal of Cancer. There is an AI algorithm that was developed that can identify cancer cells with very high accuracy. So this algorithm is using machine learning to analyze different features of cells and distinguish between normal and cancerous cells. So it's just one study, but the algorithm was able to detect breast cancer specifically with 99% accuracy compared to about 85% accuracy for human radiologists.
Oh.
So it has this technology has potential to improve early cancer detection and treatment. Now, here I think it's very important to mention that in the best future that we see for AI, in no way is it supposed to replace physicians or replace specifically radiologists in this case, because what we know is that humans have a certain success rate and certain power, and AI has a certain power, but when we have humans plus AI, this is where we get the kind of superpower that we would like to give our physicians, our doctors, our radiologists. It's an ability to combine that human, the human eye, the critical thinking component with the AI precision and the AI speed. So we're really planning to see the world where it's a combination of two things, where we might want to reduce some burden physicians and remove it completely from their workload is maybe some paperwork that is kind of minor in impact, but where we need critical thinking of the doctors. In fact, the goal is to give AI, offload some of the burden of time and effort onto the AI so that clinicians can get back to the human side of healthcare. Everyone had gotten into healthcare to take care of the patients. They really care. They want to be empathetic, but it's not a secret that there's been such a huge burnout rate in the medical profession. And that needs to be addressed. I think technology might be just one part of the answer. It's a very complicated issue, but that's where we're looking for technology not to add as a burden, additional burden, but to work with the workflow of the physicians and help them with their tasks. So going back to other things that could really help is using AI for drug discovery. So there was another study published in Nature, and by the way, we can provide some maybe links to some studies and things for the listeners to reference in the show notes. So the algorithm was trained to analyze large amount of chemical data and predict which existing compounds would have antibiotic properties. So the researchers have tested the compound predicted by the algorithm and found that it was highly effective against multiple bacteria strains. So in our world now, when we have shortage of antibiotics, we have so much drug-resistant bacteria, we need these additional tools to help us develop new antibiotics while reducing the cost of overall drug discovery. In terms of AI for predicting patient outcomes, so this is where we talk about this personalized medicine, where AI can be a critical component. Was an article in Forbes where AI was able to predict patient outcomes in intensive care units, so in ICUs, analyzing patient data, vital signs, lab results, predicting which patients were at higher risk of developing complications or dying. So this is where this technology can help physicians find a way to deploy resources to those patients that need the more urgent interventions. So patients, another example is patients receiving personalized cancer care, where the survival rate had increased to 50% after 5 years compared to 30% survival rate, for example, with kind of like a standard treatment. So these are maybe just a single study here and there. So what we're starting to see real benefit to patients through the use of AI. So more studies are needed. We need to obviously broaden kind of the aspect, but a lot of focus has been on cancer care, both from the early detection perspective, as we've mentioned, with radiology, because as we know, with majority of diseases, especially cancer, the earlier you can intervene, the better is the outcome. So of course, there is opportunity to use AI for some preventive methods. So we can talk about wellness maybe later on or at another episode. So that is where we can prevent disease as much as possible. But with cancer, we want to at least detect it as early as possible. So I could go on.
Yeah, I mean,
forget about personalized medicine and so on.
It's amazing. Yeah, we're just coming up to the break, so I'm just going to interrupt because I don't want to keep our flow going. The opportunity you're showing us is to have a better detection of cancer earlier and really be able to master that for patient outcomes. The ability to enable radiologists and other people who are working, or physicians who are working with diagnosis, to be able to reduce their workload because the AI supports it. And then really, I think the bottom line that I'm hearing from you is it's really about augmenting the human worker. It's really about augmenting that professional to help them create more balance, more care, more outcomes, and focus on what they love, And so we do have to go on a brief break. And I think stay tuned, guys, because we're going to talk about some more wellness things, maybe some longevity tools on how to incorporate information and be able to live longer and live weller, but also some of the challenges we have around regulatory. How do you set policy? How do you assure safety? I think that's fundamental. People are like, don't change healthcare because of the concerns around safety and effectiveness. So I think we're going to really tackle that. All right, stay tuned. This is Catherine Calarco. You're on Humanity Evolve. I have Irma with me, and we'll be back after a short break. Thank you so much.
Okay, good. We're all clear.
Thank you. All right, how's that feeling, Irma? Good?
It's feeling good for me. How am I doing from your perspective here?
Good. I think what's nice is you covered the high level and then dove into some examples. So we might want to, when we come back after the break, maybe pick up one example again and just say, hey, and is there one that you want to talk more about? Is there one of the examples that you'd like to talk a little bit more about?
Well, I can talk about maybe what physicians want.
Okay, perfect.
From AI and
yes.
how it could help them to give better care for patients. I think it's more of a wish list, though. I don't think it's like there and implement, but I can at least talk about what physicians are asking for from AI.
I think that's important because what I'll do is I'll start back after the break and say, hey, before the break, we talked about some amazing use cases and examples of how it's operating now to create augmented healthcare. But really often when we see implementation of new digital transformation, you see it really focused on tech first rather than physician first. So Irma, what do physicians really want from this technology? And that's the way I'll start it. Does that sound good?
Yep.
Okay, perfect. All right, Matt, let me know when you want me to come back.
Okay, yep, I'm good to go. If you're ready, I'll count you in.
Okay, cool.
Okay. All right, here we go. Segment 2, starting in 4, 3, 2.
Hello, this is Catherine Calarco. Welcome back to Humanity Evolve. I have Irma with us, who's an expert in storytelling and being an influencer and technology futurist across healthcare. Before the break, we were talking about some examples and use cases, in-depth areas where AI in healthcare is helping to transform the industry right now. Now, often with the AI and new technologies, and including digital transformation and any of these platforms, it often gets implemented from a tech-first point of view. And that's really what we want to do, is make sure that this new era is formed from a patient first, from a physician first, from a enablement and support while it's changing, so more of a change management approach rather than, hey, the tech knows, so in that regard, Irma, what do physicians want from this new era of AI in healthcare?
Well, that's a wonderful question, Catherine. I think it's so important, and we'll talk later about importance of patients and patient advocates to be involved early on with this technology. But from the physician perspective, and I'm not a physician myself, I mentioned I'm a patient, I'm a patient advocate, I'm a champion for health technology innovation, but I am hearing from physicians. They are being public in writing about this. I hear from them on social media, etc. So from physician standpoint, they want AI. They see the power of AI, and they want it to be implemented in the right way to address the current challenges that physicians are facing, and maybe even address some shortcomings that came with prior big technology push, which was the EMR, so electronic medical record or electronic health record. So that was, brought upon industry as this amazing thing that's going to make everything better. And physicians have actually struggled with it because it created additional burden on their time, on their energy. And the tool itself is not, what I'm hearing, is not that helpful to give them, even though the data is there, they're not able to get important insights and information right at their tips when they need it for a patient to make those critical decisions and to connect the dots. So what physicians want, and they consider it kind of like a low-hanging fruit for AI, because all the data, as I said, is there in the electronic medical record. So they want AI to be able to parse the data, to be able to come up with answers to physicians' questions. The physicians might ask, get for this patient, give me the lab results, looking at the trend over the last 6 months or a year, give me their imaging results, give me their risk factors, etc. And then, maybe they've asked specific questions about the medication. Oh, look at all their medications and give me a view into, which of these new 3 medications I'm considering would actually be a better fit, or do we have any genomic data on this patient that might actually inform our treatment plan, and so on. So that's one, is really being able to mine the health data in the record. And then also we talk about all this data that patients have, maybe from their wearables, data on their sleep, data on their diet and their nutrition intake, etc. So can't AI just somehow be helpful in integrating all the patient-generated data with the medical data that is, kind of official from the doctor, the lab work, etc. Again, to create these actionable insights. And then, of course, also they want AI to take on the burdensome work of administrative tasks, even within the EMR, that is not critical for patient care, but it kind of needs to be done for billing codes and all of that. Like, can just AI find the right billing code based on all the medical notes? Well, right now doctors have to do all that, and the patients suffer when the medical code is not correct. So I guess I'll stop there. Just that's one perspective from what.
Yeah, just from us being, in the healthcare system, it seems like we're re-entering the information, and X doctor doesn't know why information, and when it does get aggregated, it doesn't get aggregated for our benefit. It's usually for some other reason, or it's incorrect in 4 places, So I think there's an ability to optimize the data for a patient that helps them. It helps the doctor to give a more holistic diagnosis or treatment or recommendation. I completely agree. But when that comes up, though, there's a lot of issues around, policy and regulatory and safety and ethics. So how do you ensure, or what recommendations would you give with regard to dealing, for leaders to deal with those issues? And then we'll get to the patient advocacy as in the storytelling.
Yeah, I think we mentioned the word balance before. So I think balance is the exactly correct word to use here. So this is exactly what we need. How can we balance the amazing positive benefits of AI with the real potential downsides of this technology? So there are quite a few potential downsides, and we can talk about these various challenges. So one challenge of AI in healthcare is potential for bias, because as maybe people know, we can reiterate that AI models, AI algorithms rely on being trained on data. So in a way, we've heard garbage in, garbage out. So this is even more critical when it comes to AI, because if AI is given decision power, and it's so much more important that the data that it's being trained on is correct. It's accurate data. It's not biased. It's actually diverse, represents the diversity of the population. And as we know, even from clinical trials, they are not diverse enough. A lot of the clinical trials are being done, research is done on, majority male patients and majority white. And then the population that's being treated with that particular drug even is not majority male and white. So the same applies to AI algorithms. So we need to remove bias by making sure the data, and then initially, it might be limited, but as we start implementing AI, or planning to implement AI in more and more wide areas, we need to make sure that the data is properly used to train AI algorithms. And there's lack of regulation we mentioned on this, so that is a critical aspect, because that could also affect the data on which AI is being trained, etc. And then, keeping up. It's a very fast evolving field. So for doctors and patients and everyone who's supposed to be using AI technology to be able to keep up with all its latest developments, that's a challenge. So it's an education challenge, which also feeds into the acceptance. So what we could have is we could have, wild range of outcomes. We could have unfettered acceptance of everything. Oh, AI is going to solve everything, and then we forget about data privacy and concerns about bias, and then we just start using this everywhere. Or we could be super cautious and say, oh, no, this is so dangerous. We should not be using AI anywhere. So that finding the right balance and tapping into this opportunity for AI to really potentially revolutionize the way healthcare is delivered. So it could address challenges facing healthcare. We talked about shortages of staff, the burnout, the overburden of administrative work. But you ask, what could leaders do? Like what needs, like how do we actually address this balance? Well, there are clear guidelines that need to be developed. Right? So on the use of AI in healthcare, and there are organizations that are stepping up to do this. So for example, FDA had developed a regulatory framework for AI-powered medical devices. So that's a great start. It's designed to ensure that these medical devices powered by AI, they're still safe and effective before they can be marketed to patients. So, in National Institutes of Health, the NIH had established a working group, for example, on the ethical, legal, and social implications of AI in healthcare. This working group is developing recommendations for responsible development and use of AI in healthcare. And then American Medical Association has published a code of ethics for artificial intelligence in healthcare. So that's also another way to offer guidance on what is an ethical, responsible use of AI. So I think what's interesting is, you might have heard there's hearings in Congress with actual founders of, like, founder of OpenAI, which is a company behind ChatGPT. So even the founders and people who are at the beginning of developing of this technology years ago, they want the regulation. They don't want to be left with all the companies to be left to their own devices, because AI, could be either the next industrial revolution for us, or it could be an atomic bomb. That's what we're hearing in terms of the range of possibilities here, or the range of dangers. Okay.
I think it's so important to recognize that we as conscious leaders are at that cusp of a choice point, or a period of time where our participation helps to design the future we'd prefer to see. So it's not like leave it to somebody else. It's like we make those differences every day in what we ask for, how we want things to be seen. Is there an ethics policy, or is the data unbiased? And I think it's up to leaders to find ways to establish those policies that you talk about. And also, we talked earlier about this balance. it's also important for them to know where to go. And you mentioned some great resources, the NIH, the FDA, the AMA. There are associations that are leaning into this and really want to have stakeholder involvement. So I think that leaders can engage their teams in some of these and be able to stay at the forefront of what's needed. And also from a practical point of view, ask these questions, right? Make sure that they've got these policies and these considerations incorporated. And it's very easy. And if you want a list of them, we'll be happy to provide it. So
yeah, sure. And then it's important to note that even lawmakers, like if we want policies at the federal level to really create some of those guardrails, then there is an understanding that our current Congress is not well equipped to actually be that kind of body that can regulate AI. And that kind of became clear in these recent hearings. And there are calls from some AI experts in the field to even create international bodies, maybe similar to the World Health Organization, like a separate, maybe something similar to FDA, but it would be on a global level, because this is the kind of technology that will really affect us all globally. And yes, maybe developments that a lot of the technology is being developed here in the US, but a lot of it is being developed in China as well, and in other places around the world. So how can we globally pool the resources together and also come up with some guidelines? Because as you know, technology like the internet, once AI is there, it doesn't know any borders. It's gonna be, potentially used in every corner of the world.
Yeah, and you're absolutely correct. They've been talking about having maybe a global organization that's of educated, highly ethical, balanced governing body that helps to create a global policy to manage what we've created, because we want both enablement of this technology to augment human work, but also to remove the disequities, to really enable better healthcare globally, not just for those who have access, but also for populations that are currently underserved. And with the challenges incorporated with things like climate change on healthcare, this is an opportunity for us to potentially use AI to solve major problems that enable it to serve diverse populations. And I hope that's what's happening. And that's why obviously you and I are in this, to be part of that positive future. One thing that you mentioned earlier was about patient advocacy. So in terms of the safety and security, we touched on that a little bit. I do think security is a really highly known topic. I think people understand how important data security is. So I don't know if we need to double click on that, because I really think what's interesting for you and I is to illuminate what patient advocates and patients are how they're being considered in this process.
Yeah, this is a very important topic. It kind of touches on health equity and the importance of ethics and the patient voices. So there's actually research being done right now about the importance of incorporating perspectives of patients into the AI applications. For example, there was recently a paper published in Nature Medicine looking into patient wisdom and how it should be incorporated into health AI to prevent algorithmic paternalism. So they're trying to prevent against a particular issue. In other words, they want to make sure that AI won't take the position of doctor knows best or AI doctor knows best, even better than the human doctor. So we have to guard against over-reliance on algorithms to make sure that healthcare professionals first do not prioritize AI recommendations over patients' lived experiences and their own input and knowing kind of their own bodies, and nor choose AI kind of suggestions over their own clinical judgment. We could see that happening. There's, like I said, there's research being done into this. So there's been a movement for a while already about just in general using tapping into patient wisdom for like development of any health related product, service or device, right? But with AI, it's even so much more critical, right? So what patient advocates and patients themselves are advocating for is that patients and patient advocates need to be consulted on development of these guidelines. So maybe not necessarily just the development of technology, but on development of these guidelines and standards for the use of AI in healthcare. And so this is to address health equity and to make sure the patient's concerns are being addressed. But for that, it's also important for patients and patient advocates to be educated on AI, right? So we need to kind of know what we're dealing with here. So education is important across the board, I think, from general population, for patients and patient advocates. And one example, like we also need to know where AI is being used. So I think transparency and disclosure is very important. So we know that AI is currently already being used on the health insurance side to deny prior authorizations or look at claims. It also is being used now in some of the healthcare records, EMR and electronic medical record management, but patients are not being informed when AI might have made a decision or affected what data went into the medical record. So the push is for patients to be able to know and also correct the medical record, and also know when AI has been used at all in any kind of decision making when it comes to healthcare. So I think there's some potential receptiveness from the industry to this, but I think we have to have our voices heard and continue to push for inclusion on both policy and the technology side. And this is, that's for leaders also. You mentioned what is the role of leaders. So leaders on the technology side need to be willing to involve patients. And there are various organizations that technology developers can tap into in terms of accessing patients, because it might feel daunting. How are we going to get feedback from patients? Like, we can't just go and ask random people. But there are organizations like Savvy Co-op, for example, who has a community of patients and patients advocates, and they provide a framework for companies, whether there's drug developers and technology developers, to tap into this wisdom, the collective wisdom of the patient. Yeah. So we can be happy to provide those resources as well.
I love that. I love that you're actually, it's important for us to have that transparency and to stay educated, but not have to be figuring it all out ourselves, right? So it's asked to be transparent, ask to know when things are being used and be able to correct it. Now we're coming to the close of the show. Unfortunately, I can't believe it. We've been a great conversation, and I really want to end with storytelling. I mean, that's really your wheelhouse, and I want to know what ways can storytelling impact the ability for leaders and teams to use AI in healthcare and to use it in a patient-centric way. So tell me about storytelling.
Well, it's we can have a whole show just on storytelling, but it's just it has a real power. It has power to humanize, so it can help build trust and rapport between leaders and their teams, because we know that in any technology development, leadership is very important. So when leaders share the stories of their own experiences, it helps to humanize them and make them more relatable to their team members. Can lead to more trusting, collaborative environment, and we really need collaboration at this time with this technology that has such a huge potential. I mean, storytelling can help to inspire and motivate people. So I'm involved with TEDx Boston. So a lot of the ideas that are presented from the stage, what we want to do is we want to be able to have them be implemented, taken into the community by people who listen to the talks. So it's a huge tool to inspire and motivate people to kind of take that idea forward. Obviously, storytelling is a great way to educate and inform, and that's what we do at Avira Health, which is my company. We use storytelling on social media to educate, to bring knowledge and awareness, as well as ask for action and participation. I meing, storytelling, it's kind of like one of the absolute oldest, forms of communication. People for millennia sat around the fire and shared the traditions and stories and sometimes we forget how important it is, because even when we deal with companies, we want to deal with people, and then this technology could be so kind of faceless AI, you know, some kind of huge robot is going to come and take my job, or it's going to, you know, make all the decisions for me. Or so we don't want to lose that humanity, which is what you opened the show with. And then so AI can help us hold on to the humanity by taking some of the burden off and giving us the breathing room to actually kind of remember what's the most important and what we can focus on as humans, because we don't lose our humanity. And then, you know, creating a sense of community and belonging, which is so important in healthcare. It's actually even important for individual patients' well-being. The outcomes often depend on a patient's social network. Is there a network that they can support? Are they being optimistic? You know, so storytelling is kind of that fabric that connects us all and can make us feel, you know, not alone.
And we can all tell stories. We all start with, here was the problem, here's what I did, or this is what happened, and this is what I learned. And you can tell the same story with AI and healthcare and how it can help organizations and why something needs to happen or not happen, or what are some of the areas. I think it's super important to keep that connectedness you talked about, you know, that network. I mean, it would be is so important if we were able to enable more human connection through this, and actually be able to move to creating more balance in your life. We only have 2 minutes left, and I just, as a parting remark, Irma, if there was something you would recommend to our listeners, you know, what is one thing that you think that they can do or take forward in order to facilitate the best use of AI in healthcare for patients?
Well, that's such a big question to answer. I think as for leaders, seek that balance and participate in development of guardrails and kind of guidelines and ways to use AI ethically. And for individuals, I think, you know, whether you're already a patient or patient advocate or have a family member who is getting treatment, ask, is AI participating in decision making? Is AI being used behind the scenes? When your claim is denied by health insurance, ask, like, was there a human involved in this decision? Can somebody look at this? Can we reopen this to make sure that you understand the nuance, which AI is not, you know, AI is not trained to understand every single nuance.
Yeah, and it means the power remains with the people. So with that, I think those are two wonderful suggestions. I ask you, everybody in the audience, to just write down one or two things from this talk that you are going to be able to take forward, because right now we need all of us working together to ensure that humanity is infused into the future of our planet and technologies. It's been awesome conversation with Irma today. Please stay in touch with her. Her Twitter handle is @IrmaRast, I think RASTE. Connect with her on LinkedIn or visit her at www.evira.health, and keep the conversation going. Connect with us on LinkedIn. We're available. We want to keep talking with you. And if you need help, facilitation, or any information with regard to our conversation today, connect with us. Thank you so much. This is Catherine Kolarko with Humanity Evolve.
Thank you, Catherine. It's been a pleasure.
Thank you very much.
Bye,
Irma.
everyone.
Awesome. Love you.
All right, perfect. We're all clear.
All right,
Okay.
thanks. How did that sound, Matt?
Sounded good. Sounded good.
All right, awesome. Okay, I'll stop recording.